Hi, my name is Waylon Bell, and this is IV Therapy Catheter IV insertion. First, I'm going to check the order for accuracy and make sure the patient is an IV. Perform hand hygiene, and then gather my equipment and check the integrity of my equipment, make sure it's all good. First, I got my cleaning device, which is either alcohol or chlorhexidine. Then I got my tourniquet. Then I got my IV catheter. It is a 20 gauge, and I know that because it's pink. I got my transparent dressing. Got my catheter stabilization device, my stat lock. Got my tubing extension, which is my J-loop. Got my normal saline flush. And they got my gauze. You only need gauze if you're removing in a failed attempt. And then I got my gloves, obviously. Then I'm going to identify the patient. You use two identifiers when identifying the patient, so their name and date of birth. You can check their armband. Ask the patient which hand they're most dominant on. So in this case, the patient is right dominant, so we're going to go to the left. And then we're going to select the site. I'm going cephalic, and then I'm going to assess the non-dominant hand, arm first, from hand to upper arm. And then that's how we really choose the vein. I'm going cephalic, everything's good. Choose the catheter size, going 20 gauge. And then we're going to don our gloves. And before I don my gloves, I'm going to apply my tourniquet. Then we're gonna go to cephalic, wipe it down with some alcohol, and then we're gonna allow that to fully dry. And then we're gonna go and prime our J-loop. It's all primed. And then we're going to insert our IV. So I'm going to apply that traction, and then we're going to go bevel up. So we're going in at a 30-degree angle. There's a flash, move it to 15, and then I'm gonna insert it a little bit more. Pull out, get safety. And then we're gonna remove the tourniquet. And then we're gonna connect our J-loop to the IV. Clean any blood from the site, and then we're going to apply our stat lock here. Make sure it's all good. We're going to apply our transparent. It's good. Then we're going to check for blood return, so we're going to insert this, and we're going to flush it, pull back. There's no blood return, so we're going to flush it all the way. Then we're going to chart date, time of the IV insertion, check the patency of the IV, make sure it is all good. Dressing I used was a transparent dressing or a Tegaderm. If the IV is leaking or difficult to flush, make sure you chart that. Note the patient's tolerance. The patient did great. I did it in one attempt, and we're going to dispose of our sharps in the biohazard container.